Hey guys, welcome to my channel Not Just a Medico. In this video, I'm gonna tell you about all the important topics of anatomy. In this video, I have covered almost all the important topics that are important for your examination point of view. I assure you guys that these topics are more than enough not only to pass but also you can score really good marks. Yes guys, you can score distinction in this subject. The topics which I'm gonna tell you are taken from previous year question papers, that is the most frequently repeated topics from your previous year question papers. As you can see the questions here, but I'm gonna read out all the questions because there are few printing mistakes and there are few more topics which are not included in this printout, but I have written it in a separate book. So in between I'm gonna tell about those topics also, but it will not be shown in the video, but I will dictate it so you can write it down. So do not skip the video. Okay guys, now take out your books and start writing. Let's start with the upper limb first. So the first topic in the upper limb is median nerve in the forearm or median nerve in entire upper limb. The second topic is axillary artery. The third topic, abductor pollicis. Fourth one, first carpometacarpal joint. Fifth one, shoulder joint. Sixth one, thenar and hypothenar muscles. Seventh one, brachial plexus. Eighth one, deltoid. Ninth one, cubital fossa. 10th one, trapezius muscle. 11th one, lumbricals. 12th one, flexor retinaculum of hand. 13th one, supinatas of forearm. 14th one, radial artery. 15th one, muscle attachment of radius. 16th one, rotator cuff of shoulder. 17th one, humerus. 18th one, radius, and 19th one, ulna. And the last question is superficial palmar arch. In this you have to include formation and its branches. And please make a note that if you are watching this video in the last movement and you don't know how to form the answers, then do not forget to subscribe to my channel, because in my next upcoming video I'm gonna talk about one such textbook in which you will get readily formed answers. Yes guys, you need not to worry about that. You will get all the answers in that textbook. And also I'm gonna talk about how to present your answers in your exam. And there are few topics which you have to include in your every single answer. So yes, do not miss that video. Now coming to the next part, that is thorax. In this, the first topic is mammary gland. The second one, muscles of respiration. Third one, intervertebral disc. Fourth one, openings of diaphragm. Fifth one, features of typical rib. Sixth one, intercostal muscles. Seventh one, sternal angle. Eighth one, first rib. Ninth one, sternum. 10th one, thoracic duct. 11th one, pleura. Do not forget to include its parts and blood supply. 12th one, vertebral column. 13th one, bronchopulmonary segments. 14th one, left lung. 15th one, right lung. 16th one, medial surface of lung. 17th one, root of lung. And 18th one, describe pleura and its recesses. And yes, we are done with the upper limb and thorax. But wait, we are not completely done, because as I told you guys in the beginning that I am gonna add few more topics which I have written in a separate book. But don't worry, I might repeat those topics which you had already written in the book. You just have to cross check it. If you haven't written, then you have to write it, or if it is repeated, then mark it as very important question. Okay, so I'll start dictating now. The first question is shoulder joint. Yes, this question is repeated. You had already written this question, so you need not to write it again. You can just mark it as very important question. The second question is anatomy of heart. Third one, brachial plexus. Fourth one, radial nerve. Fifth one, cubital fossa. Sixth one, blood supply of heart. Seventh one, deltoid. Eighth one, pleura. Ninth one, pericardium. 10th one, valves of heart. 11th one, biceps. 12th one, bronchopulmonary segments. 13th one, right atrium. 14th one, diaphragm. 15th one, mediastinum. 16th one, median nerve. 17th one, musculocutaneous nerve. 18th one, ulnar nerve. 19th one, carpal tunnel. 20, axilla. 21, axillary artery. 22nd, breast lymphatic drainage. 23rd, pleura. 24th pericardium, 25th angle of Lewis, 26th root of lung, 27 upper end of humerus, 28 muscles of forearm, 29 rotator cuff muscles, and 30th one is elbow joint. You have to include carrying angle also. 31 wrist joint, 32 brachial artery. Okay, so finally we are done with upper limb and thorax. Next, in the mediastinum, the superior, inferior and the middle mediastinum, all the three are important. Now coming to the embryology part, the first question is spermatogenesis, second one oogenesis, third one fertilization, fourth one fate of corpus luteum, fifth one derivatives of ectoderm, endoderm or mesoderm, sixth one parts of neural tube, seventh one primitive streak, eighth one gastrulation. Now coming to the histology part, the first question is histology of testis, second one histology of TS bone, third one microscopy of cartilage, fourth one histology of long bone, fifth one stratified squamous epithelium, sixth one histology of skeletal muscle, seventh one histology of elastic cartilage, the last question, that is the eighth one, which is histology of transverse section of compact bone. Now coming to the heart and great vessels, the first question is arch of aorta and its branches, second one right atrium, third one right ventricle, fourth one blood supply of heart, fifth one pericardium, sixth one external features of heart, seventh one superior vena cava, eighth one inferior vena cava, ninth one coronary arteries, 10th one left atrium or left ventricle. You have to study these both, that is atrium and ventricle both. So now we are done with all the topics of upper limb and thorax, that is the topics which I had written in my book and including these topics which were shown in the video. Now let's start off with the lower limb. The first question is popliteal artery, second one femoral artery, third one lymphatic drainage of lower limb, fourth one great saphenous vein, fifth one arches of foot, sixth one popliteal fossa, seventh one quadriceps femoris, eighth one knee joint dorsalis pedis artery, ninth one hip joint, 10th one hamstrings, 11th one adductor canal, 12th one ankle joint, 13th one femoral triangle, 14th one femoral nerve, 15th one gluteus maximus, 16th one structures under gluteus maximus, 17th one femoral canal, 18th one longitudinal arches of foot, 19th one sciatic notch and structures passing through it, 20th menisci of knee, 21 extensor retinaculum of foot, 22 subtalar joint, 23 triceps surae or gastrocnemius, 24 femoral sheath, 25 knee joint, 26th iliotibial tract, 27 upper end and lower end of femur, 28th tibia. Now I'm gonna tell about those topics which I have written in a separate book. So please cross check it. The first topic is femoral triangle, second one hip joint, third one sole of foot, fourth one arches of foot, fifth one ligaments of knee, sixth one hamstrings, seventh one popliteal fossa, eighth one inguinal ligament, ninth one menisci of knee, 10th one locking and unlocking of the knee joint, 11th one iliotibial tract, 12th one gluteus group, 13th one patella, 14th one tibial tuberosity, 15th one tensor fascia lata, 16th one piriformis, 17th one bursa of knee, 18th one head of femur, 19th one femoral artery and 20th one sciatic nerve, 21 adductors, 22 triceps surae, 23 ankle joint, 24 dorsalis pedis artery, 25th quadriceps femoris, 26th adductor canal, and finally we are done with the lower limb too. Now let's start with the abdomen. The first topic is anterior abdominal muscles. The second one, diaphragm. Third one, rectus abdominis. Fourth one, bed of stomach. Fifth one, greater omentum. Sixth one, stomach, in which you have to include about blood supply and lymphatic drainage of stomach. Seventh one, external oblique muscles. Eighth one, abdominal aorta. Ninth one, lesser omentum or lesser sac. 10th one, external features of liver. 11th one, relations of liver. 12th one, ligaments of spleen. 13th one, splenic artery and its branches. 14th one, large intestine. 15th one, small intestine. 16th one, features of stomach. 17th one, spleen. 18th one, jejunum and ileum. 19th one, rectus sheath. And the last one is gallbladder. Now, let me tell you about those extra topics of abdomen. The first topic is classify female reproductive organs and describe uterus. Second one, classify male reproductive organs and describe testes. The third one, pancreas. Fourth one, duodenum. Sixth one, liver. Seventh one, lymphatic drainage of stomach. Eighth one, spleen. Ninth one, pelvic diaphragm. 10th one, relations of kidney. And 11th one, supports of uterus. 12th one, omentum. 13th one, urinary bladder. 14th one, male urethra. 15th one, adrenal gland. 16th one, rectus sheath. 17th one, bed of stomach. And yes, we are done with the abdomen. Now, let's talk about the important peripheral nerves. The first one is radial nerve. The second one, median nerve. Third one, sciatic nerve. Fourth one, ulnar nerve. Fifth one, axillary nerve or musculocutaneous nerve. Sixth one, deep peroneal nerve. Seventh one, femoral nerve. Eighth one, tibial nerve. Now, let's start with the next volume, that is head and neck. In this, the first topic is sternocleidomastoid muscle. Second one, nerve supply of tongue. Third one, digastric triangle. Fourth one, posterior triangle of neck. Fifth one, facial artery. Sixth one, structures passing through foramen ovale. Seventh one, carotid artery. Eighth one, extraocular muscles of eyeball. Ninth one, muscles of mastication. 10th one, internal jugular vein. 11th one, external jugular vein. 12th one, esophagus. 13th one, buccinator muscle. 14th one, extraocular artery. 15th one, temporomandibular joint. 16th one, carotid triangle. 17th one, constitution of larynx. Now it's time to do cross-checking with the extra questions which I'm gonna tell now. The first topic is cavernous sinus. The second one, extraocular muscles. Third one, posterior triangle. Fourth one, carotid triangle. Fifth one, circle of Willis. Sixth one, vertebral artery. Seventh one, parotid gland. Eighth one, thyroid. Ninth one, eyeball. 10th one, middle ear. 11th one, paranasal air sinus. 12th one, muscles of mastication. 13th one, muscles of the tongue. 14th one, papillae of tongue. 15th one, external carotid artery. 16th one, sternocleidomastoid. 17th one, trapezius. And the last one, that is 18th one, TMJ, that is temporomandibular joint. Okay guys, now let's start with the CNS, which is the another volume, neuroanatomy. The first topic is cross-section of spinal cord. Second one, cerebellum. Third one, lateral ventricle. Fourth one, floor of fourth ventricle. Fifth one, parts of corpus callosum. Sixth one, sulci and gyri. Seventh one, superolateral surfaces of cerebral hemisphere. Eighth one, blood supply of brain. Ninth one, blood supply of spinal cord. And the 10th one is medulla oblongata. 11th one, dural venous sinuses. 12th one cavernous sinus, 13th one midbrain, 14th one basal ganglia, 15th one ventricles of brain, 16th one middle cerebral artery, 17th one posterior cerebral artery, 18th one circle of Willis, 19th one structure of neuron, 20th nuclei of cerebellum. Okay, now it's time to cross check with these topics which I'm gonna tell now. The first topic is cerebrum. You have to write about sulci and gyri of cerebrum. The second topic, basal ganglia. Third one, internal capsule. Fourth one, cerebellum. Fifth one, medulla oblongata. Sixth one, corpus callosum. Seventh one, midbrain. Eighth one, pons. Ninth one, CSF, that is cerebrospinal fluid. 10th one, ventricles of brain. 11th one, dura mater. 12th one, neuron. 13th one, classify cranial nerves in order and describe facial nerve. Okay, finally we are done with neuroanatomy. Now I'm gonna tell you about important topics in the endocrine glands. The first topic is suprarenal gland and its hormones. Second one, pituitary gland. Third one, thyroid gland. Now we have next topic, that is kidney, urinary system and reproductive system. In these topics the important subtopics are: first one, urinary bladder. Second one, relations of kidney. Third one, right kidney. Yes, there is a spelling mistake. Fourth one, left kidney. Fifth one, parts of uterine tube. Sixth one, testes. Yes guys, I know at this point some of you might feel that I am giving too many topics, but remember, you have 4 textbooks of anatomy, that is 4 volumes of BD Chaurasia. In addition to that, you have to study histology from a separate textbook and also embryology from the different textbook. So in total you have to study 5 to 6 textbooks. In total it becomes hundreds of topics. So in front of those topics, my topics are actually less, but trust me guys, it is more than sufficient for your exam, because I have included all the frequently asked topics from your previous year question papers. But your marks also depends upon the way you present your answers in the exams. So for that also you need not to worry guys, because you know what to do, right? You just have to subscribe to my channel and wait for my next upcoming video on this topic. Now let's get back to the topics. The 7th one is anatomy of uterus. 8th one, supports of uterus. Okay, so next there are few important cranial nerves, and they are: the first one, oculomotor nerve. The second one is facial nerve, and you might get the 10-mark question like name the cranial nerves in order and describe facial nerve, or name the cranial nerves in order and describe oculomotor nerve. And finally we have come to an end of this video. I have given you all the maximum topics, so it's your time to study. I would suggest you to study all these topics thoroughly. Please do not skip any of the topic, and please make a note that these were just the important topics but not the questions. As you can see in the previous year question papers, that they might ask you to explain specifically where you cannot write about the entire whole topic. And you should also concentrate on 3 marks questions. So if you want a separate video on important questions which were repeated in your previous year question papers, then do let me know in the comment section below. And I know sometimes the pronunciation may differ, so if you have any queries related to this video or any other topics, and if you have any other video suggestions, then do let me know in the comments. And lastly, do not forget to like, share and subscribe to my channel. I'll meet you guys in the next video. Till then, bye bye and take care.